Okay, so the oncology patient's treatment journey. In this presentation, we are going to be looking at the journey the patient takes, first when they begin experiencing their symptoms, to when they're getting their treatment testing done, to their diagnosis, and finally their treatment. So first, what is cancer? Cancer is the uncontrollable growth of cells. As these cells grow, they inhibit other healthy cells around them from growing. Generally, these cells have mutated to lose a checkpoint, or these checkpoints are no longer functioning as they should, and the cell is no longer able to keep itself in check. These cancer cells can also push on a nerve, causing pain. The exact cause of cancer is unknown, but it is most likely due to the patient's genetic DNA, lifestyle choices, as well as their age. And when we are examining the patient, we are examining both signs and symptoms that we are able to determine. A sign being what we are able to see with our senses and hence is objective. For example, if a patient has high blood pressure or abnormal heart or lung sounds. A symptom, on the other hand, is what the patient is reporting to us, and it is in their subjective viewpoint. For example, feeling fatigue and weakness. A patient can experience a wide range of symptoms depending on the location and stage of their particular type of cancer. Some cancers don't show symptoms until the 4th stage, whereas others become very evident early on. For example, many lung cancers, ovarian cancers, or colorectal cancers do not show any obvious clinical symptoms until much later in its progression, and are known as late-stage cancers. Many symptoms specific to lung cancer would be persistent coughing or coughing of blood or rust-colored spit, shortness of breath, as well as chest pain. Cancers much more likely to be noticed earlier on are cancers which show up on the epithelial layer of the skin. Skin cancer, which is the most common type of cancer, can be noticed by the patients themselves or a healthcare provider when there is an obvious change in a molar wart. In particular, we would be examining for asymmetry of the mole. If the borders of the mole are uneven or blurred, multiple shades of brown or other colors such as blue or red being present within the mole, a larger size can also be an indicator of skin cancer, generally larger than 6 millimeters, as well as any significant evolution or change that occurs. A doctor may also examine the patient for lumps under the skin, especially in our patients more at risk for breast cancer. Breast cancer is one of the most common types of cancers found in women. However, only a small portion of these lumps found in breasts are actually cancerous. In fact, an article from the Cancer Institute states that more than 80% of lumps found in cancer are actually benign. Generally, our cancer patients will experience extreme tiredness, fatigue, fever, and weight loss, which is due to the cancer cells taking out much of the body's glucose supply. Cancer may also spread from its primary location to a secondary location, such as the bones, lungs, or the brain. In this case, our patients can experience an even wider range of symptoms throughout their body. We must hence be cautious if our patient complains of headaches, dizziness, balance problems, or numbness, as we must be cautious of a secondary brain mets. After diagnosing these symptoms and signs in a patient, the doctor would order a scan to further examine if this is of concern or not. Various diagnostic imaging modalities may be used to detect cancer within a patient, for example, an X-ray scan, a PET scan, a CT scan, or an MRI scan. An X-ray scan is a simple, quick method used non-invasively for the detection of cancer. However, an X scan is generally not accurate enough, and another diagnostic modality or biopsy is generally required. A PET scan or positron emission scan is the scan in which a radioactive tracer called FDG, fluorodeoxyglucose, is injected into a patient, which is taken up in a large quantity by cancer cells and will show up on the scan. Although a PET scan gives us functional imaging, if we require anatomical imaging, we may use a CT scan or them both in conjunction to give both a functional and anatomical imaging. The CT scan or computed tomography uses many X-ray beams, which creates a more detailed X-ray image, and hence this gives good visualization of tumors that are found within organs. The limit to this type of diagnostic modality is the ionizing radiation. So MRI scans can be used instead to ensure that patient is not receiving any ionizing radiation. Since an MRI produces this image using magnetic fields and radio waves, it is also able to give good soft tissue contrast and much higher spatial resolution, hence making detection of tumors much more evident. Early detection of cancer can greatly increase survivability factors for our patients, as we are able to provide our patients with optimal care and treatment. For example, patients who are more at risk of developing breast cancer should be getting breast cancer screening done earlier and more regularly. A mammogram, which is an X-ray of the breast, will allow us to catch the cancer in its primary stages, and hence will be easier to treat than if it's caught later. After our diagnostic imaging modalities have given us reason to believe there is indeed a tumor, we can confirm this result by collecting a biopsy from the patient. There are multiple ways to go about this: a fine needle aspiration biopsy, a core biopsy, an incisional biopsy, or an excisional biopsy. In a fine needle aspiration biopsy, a small needle is placed within the suspected tumor mass, and cells are aspirated out onto a cell where pathologists can further examine them. A core biopsy is different from a fine needle aspiration biopsy, in which a larger needle is used, which is able to pull cells out without destroying the architecture of the cells. This is important in suspected cancer patients, where we would want to look at the cell-to-cell relationships to see if the cell is still functioning as a normal cell would. In cancer cells, the cells are no longer obeying the same principles of cell-to-cell adherence, so by examining the architecture of the cells, it would be easy to determine if these cells are in fact cancerous. If we are sure of the cancer and would like to remove the tumor by its entirety, we would do an excisional biopsy. If performing an excisional biopsy, it is also crucial to know if the margins are positive or negative. If we have positive margins, that means we have not gotten enough of the tumor, and we must go back and remove more from that site. So pathology is the study of the nature of disease. After we have taken a sample of the patient's tissue, which we suspect as being cancerous, we can confirm our concerns by using pathological tests. A pathologist is an individual who will carry out these tests and is a crucial part of the patient's healthcare journey, as the pathology reports will determine the appropriate treatment that is chosen. This is because the pathology reports will inform us of the particular stage which the patient is in. The stage is important to determine how far the cancer has spread and now which path to take and how to treat the patient. There are multiple things that we must consider when examining a pathology report, including the type, the size, and differentiation of the neoplasm, as well as the location of the neoplasm and where it has spread. Staging the extent and spread of cancer will determine which further treatment options will be the most appropriate for the patient. If radiation therapy is chosen as the treatment plan, staging becomes important to also determine the correct plan to follow and appropriate dose required. With stage 1 being the tumor still being confined to the primary stage, stage 2 being the tumor found locally just outside the initial stage, and stage 3 being the tumor cells have reached the lymph nodes, and finally stage 4 being tumor cells are found in distant sites away from the primary site. After the pathologist has correctly identified the patient as having cancer, the doctor must then inform the patient and tell them of the various treatment options available. It is important to ensure that our patient is able to get the resources that they need in regards to understanding their specific type of cancer and the spread of their and stage of their cancer to come to a conclusion about how they would like to go about their treatment. It is also important for a patient to understand the pros and cons of each treatment plan as a whole and the risks of going without treatment. As well as receiving information about their diagnosis and their treatment, it is also crucial we look at any other social assistance that they may need to help them mentally cope and be prepared for their treatments. So their friends and family, support, or any counseling they may require. The health of the patient is a joint responsibility of many people, including not only radiation therapists, radiation oncologists, surgeons, nurses, dietitians, pathologists, and a social worker if they require one. So essentially, as healthcare providers, it is our job, along with all other healthcare providers, to work cooperatively to provide our patient with the best possible care to ensure that they are looked after both physically as well as mentally. After the patient has received all the necessary information about the cancer and the various treatment plans they may decide to go with, the patient will choose the plan considering the doctor's recommendation as the best fit for them. If a patient has a benign tumor that is pressing on their nerve and causing pain, surgery to remove the tumor may be the most appropriate method. If the tumor has metastasized to the lymph nodes, it would not make sense for us to do just a surgery, as the surgery will get rid of the cancer in a particular location. In this case, chemotherapy or radiation therapy would be more appropriate for the patient to undergo. Radiation therapy is a treatment of cancer using ionizing radiation to a specific area or the whole body. Although there are many methods of delivering this treatment, the most common technique is through the use of external beam therapy. An example of this would be treating the surface of the skin using an orthovoltage device or a LINAC accelerator to treat the organs of the body. Chemotherapy, on the other hand, is a treatment of cancer using drugs and generally works throughout the body. However, since many chemotherapy drugs do have long-term side effects, these drugs are generally used more often in a palliative care setting. It is always important to consider a patient's voice and their autonomy. The patient should always feel as though they have control over their own treatment, and hence their goals are important. So considering if a patient's goal is to fight and beat the cancer, or in contrast, if it is simply to reduce the pain, and we're using the treatment in a more palliative setting, then this will of course change the treatment route that we will take. A patient may choose to undergo palliative treatment due to prognosis and the survival rate of that particular cancer. The prognosis will depend upon a multitude of factors, such as the patient's overall health, the patient's weight, their performance in daily activity, which is measured using the Karnofsky performance scale, and the size as well as the stage of their cancer. Whereas the survival rate will depend on the total number of individuals that are able to survive a particular type of cancer for a certain amount of time. For example, the 5-year rate for lung cancer is only 5% when the disease has metastasized, and about 56% when it is localized. So as you can see, there is a certain path that our patients will take from first when they begin experiencing their symptoms to finally getting their specific treatment done. Needing our support and support of other healthcare providers along the way, we are able to work as a team to care for this individual to give them the best possible outcome for their patient journey throughout the healthcare system.